In Iquitos with Dr. Ronald Ramirez from the Amazon Hope Project, and we're going to hear about his last trip in the Amazon Hope. Ronald, greetings from Scotland.
Thank you, Willie. I'm glad you are here.
Yeah, thank you. Tell me about your recent trip on the Amazon Hope, please.
My recent trip in Amazon Hope was an ophthalmic trip, which is different from the usual trips, because in this trip we made surgeries on cataracts and pterygium. A lot of people has been blind and or almost blind because of these diseases. So we organize a trip like this once a year. And for this trip we had 3 ophthalmologists, Ian White from Inverness in Scotland, and 2 Peruvian ophthalmologists who came from the National Institute of Ophthalmology, which hospital is in Lima, Peru.
That's great. And how long did the trip last?
It lasted 7 days. Right. We have done 56 surgeries by cataracts or pterygium. 16 cataracts, and then the rest were pterygiums.
Right. And where exactly did the surgery take place? Was it here in Iquitos, or was it further out into the jungle?
We made actually 4 points of surgery. We scheduled 3 points, and they were Genaro Herrera in Ucayali River, Bagasan in Ucayali River, and Nauta in Marañón River. But actually we made 4 because we made a stop in a village called Puerto Miguel, because having 3 ophthalmologists willing to do as much surgeries as they could, we could make the surgeries quicker as we expected. So we could see more people, we could make some more surgeries.
And these places are pretty remote, is that correct?
Yes.
Right.
We had to see it, since Nauta, we had to see it 12 hours to get Genaro Herrera. And then we started the screening of the patients. Most of them had been screened during the whole year, during our regular visits to the villages. So we had a list of patients who could get the surgeries, and we could got more during the screening days.
All right. Well, hey, that's very exciting. Finally, I'd like to ask you about the patients. Tell me the sort of people that you were able to help and how they have felt about the whole experience.
Most people who got the surgeries were older than 50 years old, but I would say all of them were happy. But I would tell you about 2 patients. They were, I think they were the people who I most remember.
Yeah.
One of these is Mrs. Maria Arbeláez. He has been blind for 4 years. 10 years ago, she lost an eye during an accident, the right eye. And 4 years ago, she was blind because she's got cataracts in the left eye. So she was blind, she couldn't see, she couldn't assist herself, she couldn't eat herself, she couldn't wash herself. And after the surgery, she was very happy. She was quite happy. She couldn't, we just were seeing her smile all the time. She was saying, "Oh, I can see that boy. Oh, I can see his red t-shirt. Oh, I can see somebody moving over there." She was quite happy, and it recalls us how important is our job in these villages, remote villages. The people has not another choice to get that kind of surgeries or that kind of service because they are very poor. And I remember another patient too, who is called Julio Paya. His name is Julio Paya. He lives in the Puerto Miguel village. He was almost blind too because he's got a quite thick lesion on both eyes. He was almost blind. Despite of this, he had to go to fishing or hunting, and I've heard that some people used to mock of him because he couldn't see well. And one day he had been seen fishing in the river, in Yarapa River, when some people asked him, "So, have you got something or not?" And he said, "I will." But he didn't realize that his fishing cane, his fishing cord, was hanging on the branch of a small tree. He was hanging 1 meter in front of him, and he couldn't see. He was just waiting for the fish to come to his fishing cane. And after the surgery, he could see, and he was quite happy. He says, "Thank you very much for everybody who made this possible. The people who live in Scotland or England who even don't know him and had been possible these surgeries."
Ronald, thank you very much for sharing that, and every blessing for Christmas and for the new year to come. And we look forward to hearing more of your work in 2011. Thank you very, very much indeed.
Thank you, William.
Thank you.